The Achilles tendon is the strongest tendon in our body. A tendon connects a muscle to a bone. The Achilles tendon connects the calf muscle to the back of the heel. When people walk, they use their calf muscle. The Achilles tendon pulls. So every step you take, the Achilles tendon is working. It's not uncommon for me to have somebody come in the office with a lump on the back of their heel that's causing pain. That lump most often is in the area of the Achilles tendon attaching to the heel. People will develop a bone spur in this area. They'll get thickening of the bone. They'll develop what's called a pump bump. That's something that I'll see in women that wear a lot of high heels. The way the foot rubs on that attachment causes the body to produce bone. That bone in turn will grow into the tendon, causing bone spurring and weakening of the tendon, or pain in the tendon, causes it to be inflamed. That's something we can see on x-ray. If you have a bump on the back of your heel, you need to have an x-ray. You need to have an evaluation. There's things we can do to treat it. Things like putting people in a little heel lift or a custom orthotic. There's different braces that I'll use. Medication. There are some treatments surgically to remove the spur on occasion. There's other things we can do in the office called shockwave therapy, for example. Shockwave therapy is a technology that's relatively new that we can do in the office now. It's painless, where we use this little machine and it pounds the area with sound waves. And those sound waves in turn produce an injury to the tendon, which is more acute, making your body recognize it as if you fell off your bike and scraped your knee. Your body's going to send all the healing factors that you need to heal up. The same is true using shockwave therapy for Achilles tendinitis or insertional Achilles tendon problems, where we basically wake your body up and it heals itself. Sometimes people will develop a thickening of the Achilles tendon above the attachment. I'll see people come in and they say, I've got this knot, really hard knot in the back of my ankle. And I start looking and see that it is thickening of the Achilles tendon. Those are signs, or that can be a sign of a tear in the tendon, a partial tear that's healing. It can be inflammation, just a fluid collection around the tendon, or any number of other different things. That needs to be evaluated, and that can be treated. Again, doing some of the other things that we've done, bracing, a cast, medication, a heel lift. There's also a new procedure out that I'm using for this thickening of the tendon, and that is where we actually draw some blood out of your arm, pull out the platelets and the healing factors that you need, and under ultrasound guidance we can inject that into the tendon and it will heal it up. It'll get rid of that thickening. I have a recent patient who's a high-end triathlete who underwent this same procedure, and within 6 months he was back to running marathons. It's a great procedure. So just understand that Achilles tendinitis or Achilles tendon problems, Hagelin's deformity, there's lots of words for what's going on. Those are things that can be treated effectively, but you need to be evaluated if you're having pain in that area of your body. So just understand, foot pain is not normal, Achilles tendon pain is not normal, and it can be treated.